Evening, everyone. Uh, this is a very common issue that I deal with. You've been visiting your doctor for a while, for years, and you've had irritable bowel syndrome, irritable bowel disease, acid reflux disease. At times, you've been told you just have too much anxiety, and for whatever reason, you have ongoing abdominal pain, diarrhea, fatigue, and you start wondering, is this in my head? Eventually, you convince your doctor that it may not be in your head, and they do a scan and they refer you to a gastroenterologist, and you end up having what's called a neuroendocrine tumor. My name is Alex Ehsan. I'm a hematologist, oncologist, and I've been doing this for about 2 decades, and I hope I can help you. Uh, Now, a good friend of mine, like all my patients that have beat cancer, uh, his name is David. He was 49 years old, had a construction company for about 5 years. He was having episodes of facial flushing, diarrhea that made his work miserable because he hated using the commode, and he said it's very difficult to be in construction and having too many bowel movements. He almost didn't eat because of the cramping that he felt after meals, and his symptoms came and went, and he was a tough guy. And everybody thought it's stress because the concern was, yeah, you're building a house and then you won't be able to sell it, etc. And he basically went on. David was a tough guy, and uh, he was told that this could be stress, it could be irritable bowel syndrome, it could be fibromyalgia. Once the CT scan was done and he was sent to a gastroenterologist and there was a mass found, he wasn't in his colon, he wasn't in his pancreas, it practically was in the small intestine, and it ended up being a well differentiated neuroendocrine tumor. I never forget David asking me, Dr. Eson, if it's already in my liver, so basically it's gone everywhere and literally there's no hope, right? And I told him, no, there's definitely hope. And I'm so glad I said that because we've become close friends since, and I like to be positive rather than negative. So, neuroendocrine tumor, often called NET tumors, they they're a specialized form of tumors that literally grow up from our neuroendocrine cells. They're remarkable cells that exist through our entire body. They affect the release of our hormones in the bloodstream, and they really are a part of our nervous system. Because of that, we call them neuroendocrine tumor. Small intestine, pancreas, stomach, rectum, appendix, they're all involved. I have at least a dozen patients who have a neuroendocrine tumor in their lungs, and they kind of remain silent for years. Now, what makes them difficult to diagnose is the fact that they grow very slowly. And when you got vague symptoms, uh, abdominal pain, diarrhea, weight loss, fatigue are not things to kind of hang your hat on. And so, a big part of this ordeal is to determine, are we dealing with a tumor that's functional or non functional? And that's important because that basic that ba- that basically means, do they produce hormones? For example, if a tumor produces a hormone and therefore is functional and it's releasing serotonin, you're going to get flushing of your face. or facial flushing. Your face turns red. You get diarrhea. You can have wheezing. You can have heart valve problems over time. And that group of diseases are called carcinoid syndrome. And you also have some neuroendocrine tumors that produce insulin or gastrin or glucagon or VIPs or vasoactive peptides and other hormones. And therefore, it's a bunch of cancers all put together for some reason. So when a patient gets diagnosed with neuroendocrine tumor, it's typically you have a CAT scan, an MRI, followed by seeing a doctor who does a biopsy, typically via endoscopy. My favorite blood test is called chromogranin A, gastrin, and histamine, and I also do what's called a 24-hour 5-HIA, and the combination of all of these will tell me what hormones you're basically releasing. And now we have an advanced souped up PET scan called DOTATE or DOTATE PET CT scan that can tell us a whole lot more than what we used to know in regards to a neuroendocrine tumor. So once a biopsy is done and a confirmatory pathology is done, we look at an index called Chi-67. And this helps us determine, is this a tumor that's growing fast or not? So the treatment then depends on the grade of the tumor, whether or not this tumor produces hormones, because I would like to stop those hormones from causing you havoc. More importantly, quite often, if I can remove a tumor surgically, believe me, that's the next thing I'm going to do. Removing the primary tumor from the liver quite often benefits my patients, so that's something I do. We have two injections that we give you once a month. One is called octreotide, the other one is called lanreotide, and they're considered somatostatin analogs. And these medications are amazing because they control the hormone-related symptoms. And they slow down the growth of this tumor. One of the most exciting breakthroughs has been the peptide receptor radionuclide therapy. They refer to it as the PRRT. The medication, which is called lutetium-177 dotate, attaches to the tumor. Then it delivers radiation directly into the cancer, and it limits the damage to the normal tissue. So for my appropriate patients, PRRT has dramatically improved their disease control. And we also have older drugs like Sutent or everolimus that help. We have liver-directed therapy such as embolization or radioembolization that can definitely help. And we always have clinical trials where they help you rather than use you as a guinea pig, meaning these are treatments that have already been used, they're good, they're useful, I would give it to my kids. So many people that hear the word metastatic immediately think the worst. Neuroendocrine tumors are different. A metastatic neuroendocrine tumor is not the same as everything else. And so you may live for years and decades, and our targeted therapies, such as the hormone blocking medications that I'll be giving you, are going to just keep you alive and well for a long time. So bottom line is, if you've been diagnosed with a neuroendocrine tumor, please remember, not all cancers behave the same. Many neuroendocrine tumors grow slowly. Many of them are treatable. And these new amazing treatments that I have at my fingertips have really made me a happy oncologist. It's important to know if you can go ahead and get a dotate PET scan rather than a regular PET scan, which is what your oncologist would order. And I guarantee you, you're going to end up getting these injections and live longer and have a much better quality of life. If you happen to be one of my patients, I look forward to seeing you next week when I'm not as exhausted, and hopefully we can spend some time together. If you're not, I hope I never meet you, meaning you never have cancer. So, in a nutshell, this is not the end of you. Neuroendocrine tumors can hide for many years, but when they do show up, they do have treatment, and please don't lose faith. You'll do fine. God bless. Have a wonderful rest of your day, and I hope this has helped.